related to the left lung. Here I'm showing to you, and the pleura, and the lower two pieces are connected to the precardium. Here, area related to the precardium and area related to the pleura and the left lung. Number 4 of attachments of the body of sternum is located between the facets for articulation with the costal cartilage. Between the facets for articulation with the costal cartilage, the lateral borders provide attachment to the external intercostal membranes and to the internal intercostal muscles that I will show you in the next slides. About the sternum, the third part of the sternum is xiphoid process. Xiphoid process is the smallest part of the sternum. It is at first cartilaginous, but in the adult it becomes ossified near its upper end. It varies greatly in shape and may be bifid or perforated. It lies in the floor of the epigastric fossa that I said before in the lesson 1. Do you remember it? Where is it, epigastric fossa? So let's back to the lesson 1 and study the epigastric fossa and the xiphoid process. How about xiphoid process attachment? The anterior surface of the xiphoid process provides insertion to the medial fibers of the rectus abdominis. Here is the surface to attachment of rectus abdominis and to the aponeurosis of external and internal oblique muscles to the abdomen. Aponeurosis to the oblique muscles. That's related to the abdomen. The posterior surface gives origin to the diaphragm. It is related to the anterior surface of the liver. The lateral borders of the xiphoid process, as you can see here, give attachment to the aponeurosis of the internal oblique and transverse abdominis muscles. That's related to the lateral border. The upper ends I'm showing here is upper end forms a primary cartilaginous joint with the body of the sternum, and the lower end affords attachment to the linea alba. It's a white line that surgeons use it to open the abdomen in a surgery operation. So, how about ossification of the sternum? The sternum develops by fusion of two sternal plates formed on either side of the midline. The fusion of the two plates takes place in a craniocaudal direction. Manubrium is ossified from two centers, appearing in 5 fetal mounts. First and second sternebrae ossify from one center, appearing in 5 fetal mounts. Third and fourth sternebrae ossify from the paired centers, which appears in 5 and 6 mounts. These fuse with each other from below upwards during puberty. Fusion is complete by 25 years of age. The manubriosternal joint, which is a secondary cartilaginous joint, usually persists through life. The center for the xiphoid process appears during the third year or later. It fuse with the body at about 40 years. In an abnormal situation of the sternum or clinical anatomy, we have two options that you are looking at in the left pictures of this slide, and we can use maneuver of sternum for aspiration of the bone marrow for medical use. Bone marrow for examination is usually obtained by manubriosternal puncture, like this picture. It is done in its upper half to prevent injury to arc of aorta, which lies behind its lower half. The slide movements that take place at the manubriosternal joint are essential for movement of the ribs. In the anomaly called funnel chest, the sternum is depressed like this. Is a funnel chest and the sternum depressed. In another anomaly called pigeon chest, there is forward projection of the sternum like the keel of a boat and flattening of the chest wall on either side. For cardiac surgery, the manubrium and or body of sternum needs to be splitted in midline, and incision is closed with stainless steel wires. Sternum is protected from injury by attachment of elastic costal cartilage. Indirect violence may lead to the fracture of the sternum. Non-fusion of the sternal plates cause ectopia cordis, where the heart lies uncovered on the surface. Partial fusion of the plates may lead to the formation of sternal foramina, bifid xiphoid process, and etc. Another section is about walls of the thorax. The thorax is covered by muscles of pectoral region of upper limb. In addition, the intercostal muscles and membranes fill up the gaps between adjacent ribs and cartilage. These muscles provide integrity to the thoracic wall. A right and left pair of thoracic nerves fulfill the exact definition of the dermatum. The posterior intercostal vein, posterior intercostal artery, and intercostal nerve lie from above downwards in the costal groove of the ribs. That's very important to keep in mind. Sympathetic part of the autonomic nervous system starts from the lateral horns of thoracic 1 to thoracic 12 segments of the spinal cord. It continues up to lumbar second segment. Covering of the thoracic wall. What is the covering of the thoracic wall? The thoracic wall is covered from outside to inside, as you can see here in this picture, outside to inside by the following structure: skin, superficial fascia, deep fascia, and extrinsic muscles The extrinsic muscles covering the thorax can be categorized as the blue. The muscles of the upper limb, the muscles of the abdomen, and the thoracic wall proper muscles. So we have three muscles related to the thoracic wall. Number one is muscles of the upper limb.